My name is Shaji Kumar. I'm from Mayo Clinic in Rochester, Minnesota, and I'm attending the 61st annual ASH meeting. There's a lot of data that is being presented with new therapies and results of clinical trials in multiple myeloma. The updated results of the Bellini trial that combined venetoclax with the bortezomib and dexamethasone was presented at the ASH meeting. This phase 3 trial examined the impact of adding venetoclax to the combination of bortezomib and dexamethasone in patients with relapsed myeloma who had 1 to 3 prior lines of therapy. Initially, the trial results that were presented earlier in 2019 showed that the addition of venetoclax to bortezomib and dexamethasone significantly improved the progression-free survival, almost 2 years compared to 1 year with bortezomib dexamethasone. However, there was also an increased death rate in patients receiving the venetoclax, suggesting toxicity, and most of the initial data was suggestive of increased risk of infection in patients getting venetoclax with bortezomib and dexamethasone. The updated data again supports the initial observation that the progression-free survival is significantly improved with the addition of venetoclax to bortezomib and dexamethasone. However, the difference in the mortality or the overall survival is not significantly different at this point, even though it still continues to favor the placebo arm over the venetoclax arm. Looking at the various subgroups that were originally planned, particularly the T1114 subgroup and the group with the high expression of BCL2, it is very clear that those patients appear to derive significantly more benefit than the remaining patients. So if you look at the group of patients who are 1114 positive, their progression-free survival was significantly improved with venetoclax with a hazard ratio of 0.01. In contrast, when you look at the patients who are high risk, like translocation 414, those patients did not derive much benefit but had significantly worse overall survival. In addition, when you look at the BCL2 high expressing myeloma, those patients also had a better progression-free survival without any impact on the overall survival, just like what was observed in the translocation 1114 patient group. And these patients had their BCL2 expression measured using quantitative PCR. So it is apparent now that the group of patients who are 1114 positive or BCL2 high expressing appears to derive clear benefit with the use of venetoclax used in combination with bortezomib and dexamethasone. In contrast, the patients who have high-risk cytogenetics or who are BCL2 low appear to be the ones that have no benefit with the addition of venetoclax. In fact, have worse outcomes in terms of overall survival. The updated results also showed that the initial safety data that was seen with respect to hematological toxicity and GI toxicity continues to be very similar. So ongoing trials are focusing on the T1114 patients to see if those patients would be benefited with the addition of venetoclax to standard therapy or instead of standard therapy.